that you can be heard as well.
Will do.
I just want to make sure with Jonathan that he's got the live stream going. So I just sent him a text and said, are you ready for live stream?
Yep, we're all set, Trevor.
Oh, okay. Oh, great. Thanks, Jonathan.
And again, any departmental representatives, if you would mute yourselves until such time as you'd be called upon to address your item for this meeting, that would be very much appreciated so that we don't have any background noise. Thank you.
Trevor, this is Bob Francis, people too. I just want to let you know I'm on the phone.
Oh, thanks, Bob. So our financial advisor is on the phone as well, council members. Bob France. Ready, Jean?
I'm ready.
Okay, go ahead.
You ready, Mr. President?
I'm ready.
Okay.
We're calling to order the Cuyahoga County Remote Committee of the Whole meeting for Tuesday, the 25th, 2020. Clerk, would you please call the roll?
Calling the roll, Mr. Schron.
Here.
Ms. Conwell.
Here.
Mr. Jones.
Here.
Ms. Brown. Here. Ms. Stevens.
Present.
Ms. Simon.
Here.
Ms. Baker.
Here.
Mr. Miller.
Here.
Mr. Tuma.
Here.
Mr. Gallagher.
Here.
Council President Brady.
Here.
You have a quorum.
Thank you. Is there any public comment today, Madam Clerk?
Mr. President, no public comment was received by me via email by the 1 p.m. time frame.
Okay, thank you. Under the fourth item, the presentation by Mr. Chambers, we're going to do what we did a week ago and hold that until we get through with the regular agenda. And so we're now down to item 5, items referred to the committee. And clerk, would you please read, well, this resolution, I don't know whether you really need to read it or not. I guess not. R 2020-0087 regarding the Metro Health system loan, so to speak, has the administration has asked for that to be held. Apparently there's a little, we need to let legal, both from the hospital and from the county, take another look at this resolution. Is that a fair explanation?
Mr. Chairman, this is Greg Huth. Yes, that's accurate. Thank you.
Okay, all right. So we'll go on to the next resolution, and Madam Clerk, could you read the next resolution?
Resolution number 2020-0088, authorizing amendments to agreements and contracts with various providers for community-based services to support at-risk children and families in Cuyahoga County for various time periods, to extend the time periods to March 31st, 2021, and for additional funds as printed on the agenda.
All right, I'm going to turn over this discussion to the chairperson of the Health and Human Service Committee, Yvonne Conwell.
I am having some technical difficulties. Hold on one second. It's saying battery low. So give me a few seconds. I will plug this up. Don't want it to die on me. All right, good afternoon, everyone.
Good afternoon.
Good afternoon.
Okay, may I ask Mr. Chambers, who is available in the audience? Will Jackie McCray or Dave Merriman be presenting?
This is Christine Alexander. I will be presenting today.
Okay. Says maintenance in 10 minutes. Sure. Just to let you know, I'm having technical difficulties, and it's saying your computer is being restarted and it will close in a few minutes. So I don't know if you guys will lose me or not. So can you please present this item?
Sure.
Resolution 2020?
Thank you. This is Christine Alexander, Department of Health and Human Services. I am here on behalf of the Division of Children and Family Services. We are seeking to amend the community-based service contract for 1 year, ending 3/31/21. The community-based services providers serve families at risk of entering or who have already entered the child welfare system in Cuyahoga County. Services address the complex needs of youth and families and focus on safety and permanence for children, as well as emotional and economic well-being for parents and permanent stable housing for youth that are aging out of foster care. The goals of the community-based services are improving the safety of children in their own homes, reducing the rate of entry into foster care, decreasing the length of stay for children in placement, and increasing the housing stability for youth aging out of foster care. Services are delivered through a comprehensive array of activities designed to support and strengthen families. These activities include outreach and engagement, needs assessment, service planning and coordination, emergency assistance, as well as attendance at family team meetings with Dcfs staff, monitoring family visits between children and birth parents, and providing independent living skills for youth that are aging out of the foster care system. Dcfs is contracted with the community-based services for more than 2 decades now to deliver easily accessible, neighborhood-based services and supports to families in need. The agencies in turn develop networks in each neighborhood, which include the residents, grassroots and faith-based organizations, various businesses, school systems, medical providers, and community leaders. During the most recent contract year, which began April 2019, the community-based services providers together served 2,726 families, attended 3,966 family meetings, facilitated 6,467 family visitations, and provided emergency assistance to more than 1,300 families to help meet basic needs, such as food, rental assistance, and help with utilities. These providers were chosen through a formal competitive procurement process in 2017. There were 12 proposals that were received at that time, and 9 agencies were awarded a contract. The awards were made based upon an extensive valuation process. Dcfs is currently in the process of drafting RFP to release this fall for a new contract beginning in April 1st of 2021. I do want to mention that one reason this is late is that the amendment had to be withdrawn from the new Invoice system in order to allow outstanding invoices to be processed. The current Invoice system does not allow payments to be made to the providers on their purchase orders while the contract is currently being amended. This required the re-entry of amendment information for all providers into Infor once those invoices were paid. Also with me, I have on the line 2 key Dcfs staff, Jackie McCrae, the Deputy Director of Resource and Placement, Joseph Jackson, Senior Manager, as well as Rachel Milner, Executive Director of the Westside Community House. Westside Community House is currently the organization that is the most heavily utilized among our community-based services providers. I will entertain questions now.
Christine, I would just, I'm glad you mentioned the when the next RFP. That was one of my questions. But during this crisis, there has been slow payments that were made to the agencies. Have all the invoices been caught up, and are they current?
They're currently in the system, and we have actually several of our providers have already submitted their most recent end of the year invoices, and those have been processed and they are being paid now.
I have no further questions. Is there any questions from the committee members?
I do. Okay, Dale.
Sunny?
Sure, thank you so much. Just a question on the Infor, the delay caused by this new system. It seems really laborious and you know, difficult to get contracts amendments through. Is that going to change? Have we fixed the problem, or are we planning on that? And what's the time frame?
So thank you. And actually, this is probably the most difficult bit because a single item involved 9 different providers. Generally, we have a single provider or a master contract, which is a little bit easier. We were able to develop a workaround so that this procedure in the future will not inhibit a payment while an amendment is being worked on. My understanding is that phase 2 of the Infor system should address some of these contracting issues. I'm not sure what the time frame for that is.
Thank you.
Any other questions in regards to this?
Yes, Madam Chair.
Councilman Miller.
to Madam Chair, to Ms. Alexander, the 9 providers that were approved, are these all providers that were operating in the past? And are any of the 3 that were not approved, are they people who were applying to be new providers, or are these people who we've had in the past, but we decided not to approve them for another round?
So 2 of the 3 that were not approved were actually submitted responses that weren't in concert with what we were seeking through the RFP. The 3rd provider was later added to the contract, and that was Harvard Community Center.
So, Ms. Alexander, the one that was later added, is that one not a part of this amendment, or how?
No,
How
I'm
is
sorry.
that going to be handled?
Thank you for the question. Harvard Community Center is on the resolution. The time period is slightly different than the other 8 providers, but they are part of the 9 total contract service providers.
So, Ms. Alexander, you said that there were 3 that are not approved. Are the 3 that were not approved, were these new applicants?
2 of the 3 were new applicants, yes.
And then what was the 3rd one?
The 3rd one was Harvard Community Center, which was later added.
Madam Chair, Ms. Alexander, this isn't adding up for me. You know, you said that there were 12 applicants and 8 were funded and 3 were not. Well, if you had 3 that were not funded, but one of them is Harvard Community Center, well, then you should only have a total of 11 applicants.
My apologies, Council Miller. I'm sorry, I don't have the list of the original applicants. I can certainly look that up for you.
If I may, this is Councilwoman Brown. Is this, through the chair, is this the contract where the YWCA was a part of it? And I think they have been eliminated. I think they're one of the contracts that we no longer appropriated funds for, Councilman Miller.
Correct.
It was the YMCA.
Okay.
Yes. And we should be in the, Ms. Alexander, we should be in the 2nd year of this contract, correct?
This is the beginning of the 3rd year. So there was the 1st year was 1 year, and this is the 2nd of 2 option years.
Are you satisfied, Councilman Miller?
Yes, for now, but I would appreciate a follow-up report.
Absolutely.
That lists all the applicants, old and new.
Thank you.
Okay, is there any other questions in regards to this?
Yes, Madam.
Councilman Jones.
Thank you.
Yeah, Ms. Alexander, I'd like to know, speak a little bit about the outcomes we've been having, if you're aware, around our at-risk children in light of the COVID-19. Is there any insight or any glimpse into a window into what's been happening that you can share in terms of our providers?
Thank you. That's why I have actually the senior managers from Department of Children and Family Services that can address that.
Okay.
Jackie or Joe?
Good afternoon, this is Jackie McCray. In terms of our children, we are still serving our children. Many of our staff are working remotely, but we are still on the front line serving our children that are at risk. And our neighborhood providers are on the front lines with us as well, providing those extra needed supports and services to families in this time of need. What we are noticing in terms of our agency is that there has been a significant decrease in the number of calls coming through to our kids' hotlines. And we have made information available to the community in terms of other means to report concerns of abuse or neglect online, through Facebook. We are beginning to see some of those things come through. But with children being, you know, basically at home at this point, not attending school, a lot of the daycares closed. Many of the eyes that were on children and many of the day-to-day contacts that they were having, they're not having those contacts as usual, so we don't necessarily have all those eyes in the community that had traditionally been on our children on a day-to-day basis.
So if I'm hearing what you're saying, in the past, the children were coming into the East End neighborhoods, into the centers, and now they're just not coming in they're not coming to the facilities as they had in the past.
Due to current situation, it has required everyone to, you know, do business a little differently. The services are available. Many services are being handled remotely at this point in time. And Rachelle, you know, Milner is here, and she can talk about right on the front line how they're handling some of the contacts with their families in light of the current situation that all of us are facing. Rachelle, do you want to speak to that?
Sure. Good afternoon.
Good afternoon.
Currently, visitations for children that are in alternate care are still occurring as deemed necessary by the Dcfs social worker. At Westside Community House, we typically have 35 families that visit each month. Right now, due to the situation in the community, we have about 5 or 6, and these families are closest to reunification, and so we're still making our building spaces available to these families.
Okay.
In addition to that, our staff are working remotely. However, they are still reaching out to their families and connecting with them via Facebook, any social program that we could use, any virtual platform that's available, and phone calls as well. We're still on the ground helping families with emergency assistance if they may need it for rent, utilities, food, anything that the families may need in the community. So as it relates to the neighborhood collaboratives and our response to the current situation, we are in position and still servicing families.
Have you gotten any requests for face masks?
As far as from people, no. What we do see right now is a very well response from people in the community that are making the masks. And we are right now trying to strategize what it looks like when everyone is released back to the community and to our buildings. You know, will children have to wear masks? What does that look like for everyone? So we're just right now strategizing with our infrastructure to make sure that we're prepared.
Okay. All right, thank you.
Those are great questions. Any further questions in regards to this?
Madam Chair, if I may.
Councilwoman Brown?
Thank you. I just want to give a point of clarification from Ms. McCray with regards to the referral system. It was indicated, I think by Ms. Alexander, that there has been a reduction in referrals, and you said due to the situation. Is that not so much the fact that they're not coming in to the community centers, but because they're not in school, so teachers and coaches and individuals like that aren't interacting with the children? Is that more specific with regards to why we're not seeing as many referrals? Can you just clarify that for me, please?
All of the things that you mentioned are contributors to why we believe we're not receiving as many referrals on our kids hotline at this point in time.
Okay, thank you.
You're welcome.
Ms. Deputy Director McCray, that would go to the same point as actually the people going into the centers, correct? Due to this pandemic?
I believe it would apply. Many people are, you know, afraid to come out, so they're not going out as much. So people are sheltering and staying in place at home, and that is contributing to a lot of the actual in-person, face-to-face activity that our community centers are seeing, and to some degree, the access that some of the kids have to people who would traditionally report concerns of abuse or neglect.
So are we to expect that maybe as we're planning on passing this resolution, that not too many invoices may come depending throughout the summer months. So it might be actually extra money left into the contract for each agency. And I know in the past, the county has frowned upon that in terms of a community agency not utilizing all their funds. So I want to just make it clear that we're going to take this in consideration, that we're going through the pandemic, and there's a lot of families that are fearful and do not want to participate.
Yes, I can speak to that, Councilwoman Conwell. These contracts are 100% cost reimbursement, and they are staffed at a level that has historically they have expected families to come in. We will definitely monitor whether or not fewer families are coming in. I think some of the services are available remotely, and some of the agencies have repositioned themselves to deliver services in a different manner. So if in fact they have a food pantry, for example, they may be delivering, or a congregate meal program, they may be delivering meals instead. So we'll definitely monitor whether or not the utilization is down because they cannot control the number of families that walk in their door. They are staffed to receive what they've traditionally received over the past 3 years.
How does DCFS view this? In terms of, I don't know if they keep a record of how many people come in for, the different families that have the open cases. So is there anyone to speak to that?
Well, as I had stated earlier, we are still very much involved with the families that we're serving. We're just serving them in a different way. A lot of it is still happening. Some of the visits are taking place virtually, but we are still receiving referrals at this point, and we're still working with families that have been involved with us even prior to this pandemic. So those things continue, and the needs of those families just continue to evolve.
Okay, Deputy Director McCray, digital divide, does it play a role anywhere in it?
In terms of some of the technology that's available to families to participate in some things that may be virtual, that does impact the family's ability to participate in some things. For example, if telehealth services are being offered, a family that does not have the technology or the electronic devices for that, that poses a hardship for them.
Thank you. Is there any other further questions in regards to this piece of legislation? Hearing none, I know you guys wanted second reading suspension. Is that correct, Ms. Alexander?
That's correct.
Okay. So I'd like to make a motion to move this to the full council. Second reading suspension. Do I have a second?
Second.
Okay. All in favor? Aye. And
Aye.
then move to the full council.
Sorry, Councilwoman Conwell, I was muted. The one thing, can someone tell me why this is only through March 2020?
Well, as she stated earlier, and I don't know if it has anything to do with it, the new RFP is being worked on now, and it will be released April 21st of 2021.
Okay, because the extensions are, okay, I'm sorry, it's through 2021, but it looks like the extensions are only through 2020. So I guess that's why it looks that way. Okay, my apologies.
No
Thank
problem.
Ms. Conwell, may I clarify, please? So
Yes.
in doing the agenda, what we try and do basically in the main caption is to gather the things that are common, and then to say that each one of these items the time period will be extended to March 31st, 2021. And then in the basis of it, so the very first items were already through March 31st, 2020. So now they're all being extended to March 31st, 2021.
Okay.
So it's just how the agenda is written.
Okay, thank you.
I believe it was moved and seconded already. And it's been moved to the full council. All in favor, say aye.
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 All right. I turn it over to Council President.
Thank you.
Thank you, Councilman
Mr.
Conrad.
President,
Yes, Councilman.
I would like to have my name added to the legislation, please.
All right, clerk, please add Councilman Miller's name to the legislation.
Yes, sir.
And clerk, would you read the next item?
Resolution number 2020-0089, authorizing an amendment to agreement number AG 1900-216 with City of Cleveland Department of Public Health for administration, coordination, prenatal, and interconceptional care services to high-risk families in connection with expansion of the Moms First program for the Invest in Children program for the period January 1, 2020 through December 31, 2021, to change the scope of services effective January 1, 2020, and for additional funds in the amount not to exceed $774,940.
Good afternoon, Council. Rebecca Dorman here from Invest in Children at Office of Early Childhood. Bob Stabe is here as well, and Marcos Cortez, all to help answer any questions you have.
Okay, thank you. For just a second, we're going to turn this, I'm going to turn the chair over to Chairman Simon for this particular resolution.
Okay.
Thank you, President Brady. Good afternoon, everybody from Invest in Children. So we heard this item in January and anticipated money coming in through the state Medicaid program. And now the dollars are here to enhance the Moms First program and contract we have with the City of Cleveland. And I think you can speak to that in more detail, and as well as to say how we're still providing services to the moms in Cleveland, despite the pandemic, food deliveries, I think, and so you can be specific, but we did anticipate these dollars and I would appreciate support. Thank you.
Sure. So as Councilmember Simon stated, that this amendment follows a revenue generating agreement the council had approved back in January, pre-pandemic. It will allow Moms First to serve an additional 450 families over the next 2 years. This is the third time we've received these funds. And just to clarify, the funds originate with the 5 managed care companies in Ohio who give the dollars to First Year Cleveland. Case Western Reserve is the fiscal agent for First Year Cleveland, and then the dollars come to us and we provide them to Moms First. Specifically, the funding that comes from managed care is to address the unacceptably high infant mortality rate in Ohio, and specifically the disparity which shows African American babies dying at much higher rates than white babies. And the Moms First program, as you all may recall, provides home visiting to women in the City of Cleveland. It has been around for about 25 years now, serving them beginning in the prenatal period, and the emphasis is on healthy birth outcomes. And they have done a fabulous job based on the outcome data. So to give you some specifics about what's going on now, during the pandemic, they have continued to operate. The digital divide, however, which was alluded to previously, does affect their ability to do virtual visits. So what they have done is they have done about 110 virtual visits, also 2,157 phone call visits. So that has been the lifeline and the workaround to continue services. They've also made 393 emergency supply deliveries to families, which could be diapers or formulas or a pack and play, etc. In addition, they've also, we've expanded a Facebook group that has been operating with our Parents as Teachers program called Parents Connect. It was a really successful, sort of started as an experiment with grant funding, but has been really successful, supporting about 250 moms through that program. But now, given the pandemic, we've expanded the group out to all of our home visiting programs. So that's another way for families to be connected to other moms as well as to this, to their home visitors, etc. So the work does continue, and I'm happy to take questions at this point. My colleagues are here to support me in that.
Any questions? Okay.
Yes, I had the mute button.
Okay. All right.
Thank you, Madam Chair.
Um,
Hi, Rebecca.
Hi.
Hi. My question centers around just giving us some insight into the outcomes. You mentioned infant mortality and the high rate in the African American community. A lot of times this contract, others, and just our tendency in county to talk about output, how many meetings, how many quantifiable things. But I'd like to hear more your outcomes. What are your measurements or your metrics for outcomes around this issue, and speak a little bit to that issue?
Sure, thank you. Well, we have a very clear metric in this case, which is infant mortality. And Moms First, I will give you the numbers from 2019. They served 1,102 families. Their infant mortality rate was 4.96, which compares to the city of Cleveland's rate of 12.9. So that is a remarkable reduction. It's actually lower than the white infant mortality rate in the county and the state. So certainly we wish it was zero, but they certainly have proven that they are making a significant impact.
Okay, and just for clarity, what actions do you attribute to that outcome?
Well, I mean, the program, as I said, it's been around for 25 years. Its core funding is a federal grant. I think that they have, first of all, developed an amazing reputation in the community. Word of mouth is probably their best recruitment tool. So, and they use community health workers who are women who have been well-trained, but are also coming from the community and are known and trusted. They're there from the beginning of the prenatal period to provide the support. And, you know, there's a good curriculum, but I think it really is about the relationship. Often in these programs, curricula come and go, but it's what is the relationship between that pregnant woman or that mom and the worker who is in the home. And there's some great personal testimonials about how much those relationships mean to women who may otherwise not have anyone supporting them during the pregnancy, the birth, and beyond.
Can I jump in here? This is Marcos Cortez with Invest in Children. So, you know, Moms First works on obviously addressing in the outcomes that affect good birth results, such as nutrition, smoking, substance abuse. But they also work on addressing the social determinants of health, which is another step up, which includes inadequate housing, education, and other stressors. So I think combining those two approaches leads to the results that we see.
Thank you, Marcos.
All right, thank you, I appreciate it.
Madam Chair, if I may, since Ms. Dorman, Dr. Dorman mentioned that the compilation of the employees, can you share with us the demographics of the workers who are out in the community? You may not have that right in front of you, but if you provide it for us.
They're 100% African American.
Okay. All right. Thank you.
Thank you. So yeah, this is a success story, and so we need a suspension on this for the next full council meeting?
That would be great. Thank you.
Yeah, it looks like we're behind the times a little bit. So yeah, I can make that. I guess we need to make a motion that this will be referred to the full council under a recommendation of suspension of rules. Second read.
A second, Brown.
Thank you.
Thank you. We need to vote.
Yeah.
Okay.
All those in favor?
Yeah.
All those in favor say aye.
Aye. All those opposed? Ayes have it, the resolution is adopted. Thank you, Councilwoman. Madam Clerk, would you read the next resolution, please?
Yes, Mr. President, excuse me, ordinance number 2020-0009, amending uncodified ordinance number 2020-0008, dated April 14, 2020, which amended uncodified ordinance number 2020-0007, dated March 16, 2020, which provided for paid emergency administrative leave for all county employees and which deleted the requirement that the paid emergency administrative leave can only be used after the employee has exhausted his or her existing accrued sick leave by revising the date on which the paid emergency administrative leave will expire.
And could we have the law director explain this resolution to the council? I know this has been kicked around for a while, back and forth, and normally would have gone to HR, but I understand it's pretty much worked out. But Mr. Law Director, could you explain the need for this resolution?
Certainly, Mr. Chairman. When the paid administrative leave was first implemented, and the concept was that the employees had to exhaust their other sick leave before they could take advantage of it. At that time, the administration's intent was to allow the paid administrative leave to carry on through the end of this calendar year. However, at the last meeting, that uncodified ordinance was amended so that the employees are no longer required to exhaust their other leaves, so they will have other leaves that will carry over through the end of the calendar year and beyond. So this ordinance from the administration suggests now that the paid administrative leave will expire either at the end of the emergency, when that's declared by the state, or the end of the last pay period of 2020, whichever comes first.
Okay, so this came out of the legislation we passed at the last council meeting last Tuesday. Is there questions or comments on this legislation by the council?
Mr. President, I have a comment. Can you hear me today?
Yes.
Oh, yes. One, I just want to have my name added to this piece of legislation. I received several calls from employees over the last few weeks about this issue, and the employees felt it was not fair that they had to use their sick leave when these monies were available. So I definitely agree with this and support this piece of legislation.
Okay, thank you, Councilman. Any other questions or comments?
Mr. President.
Councilman.
To the law department, my one question is that the ending of the emergency declaration might come fairly suddenly. Is there a need for employees to have some advance notice of when the emergency would be ended so that they could plan how they're going to handle their leave time?
That's an interesting question. Do you mind if I bounce that over to Holly?
Okay, all right. Welcome, Holly.
Good afternoon, Holly Woods, Interim Director of HR. So as you know, we have provided our employees with quite a few different options of leave. So we have the emergency leave, we have the federal sick leave that we're required to provide. Employees are also provided with extended family medical leave. In addition, at this point in time, they can take their accrued leaves or choose to go on unpaid leave. So if employees are off work now, most of them are either using their emergency leave, or again, they have an option of even getting expanded emergency leave. So upon lifting of the emergency, we would give, appropriate notice, just as we did when we ended the paid closure leave, to go ahead and put an end date to that emergency leave so that it wouldn't continue on through the end of the year.
So you're suggesting then that the access to the emergency leave would not end on the same day that the notice that the emergency is ended, but that some notice to the employee would be provided. Is that what you're saying?
I am, yes. Of course, if they notified us tomorrow midday, we're not going to stop it immediately. We want to give employees appropriate notice so they can finish out that leave without cutting someone off in the middle of that leave time frame.
Okay, thank you.
All right. Any further questions or comments about this legislation? Councilman Jones?
Yes. Is this retroactive back to when our employees were first working from home? Is this retroactive?
So I believe your question is in regards to the lifting of the requirement to exhaust the sick time. Is that correct?
That's correct. Do they get their sick time back if it was taken when they were sent home?
So that requirement was actually lifted the last time we came through with an amendment, and employees did have the opportunity to go back and revise their timesheets to change their sick time that they had taken to another leave if they desired to, and they still can today if they desired to as well.
Okay, thank you.
Mm-hmm.
All right. Anyone else? All right. Hearing no one, I'd like to move this legislation to be referred to the full council for consideration for second reading adoption under suspension of the rules. Do I have a second?
Second, this is Dave.
Okay. All those in favor say aye.
Aye.
Aye. All those opposed? Ayes have it. The resolution is adopted. We're going to now revert back to item number 4 with the presentation by Mr. Chambers, and we're turning over the chair to our finance chair, Councilman Miller.
Thank you very much, Mr. President and my colleagues. Today is the second of 3 sessions on the county's finances in response to the COVID-19 crisis. Last week we focused on currently available financial projections and federal CARES Act assistance. Today's meeting will focus on possible action steps in response to the financial aspects of the crisis. On Monday, May the 18th at 1 p.m., the Finance and Budgeting Committee will conduct the regular annual review of the county's financial report for the first quarter. To start today's meeting, I'm going to call upon Chief Mason and/or Director Chambers to present the administration's view on how we should deal with the financial shortfall, followed by questions and answers. I encourage my colleagues to be wide-ranging in pursuing chosen topics of inquiry, my only request being that we be respectful toward everybody. I would ask that everybody who's speaking, whether council or administration, identify themselves when starting to speak. And before I turn it over to the administration, I would just like to commend Interim Director Holly Woods for her outstanding service to the county during this difficult transitional time as she announces that she's moving on to other things. So I now call upon the administration for their presentation.
Mr. Chairman, this is Mason. I believe
Yes.
Executive Budish would like to address first.
Mr. Executive.
Thank you, Councilman Miller. I just have a few remarks. At the council hearing on the budget last week, I got the sense that some on council felt that the administration is being overly conservative in our budget projections and that we may be acting too quickly. So I want to take a moment to state our position and reasoning. We're in the throes of a crisis none of us has ever lived through. the impact on our economy has been staggering. We're currently projecting a $76 million loss in revenues, or about 20%. This is because revenues from sales and other taxes have fallen off a cliff, and we don't see the economy coming back full throttle for months and months, maybe longer. We're not alone in making these projections. The National Association of Counties projected Franklin County sales taxes falling 25%. Hamilton County is looking at 20%. Claremont County projects a 40% sales tax drop. Other counties around the country are projecting huge sales tax drops as well. If anything, our loss projections are perhaps on the lower end. And I've just been notified that Governor DeWine announced that the state's cutting $775 million in 2 months. So we're definitely not alone. What do? Some people wonder why we don't just spend our reserves. Some people wonder why we don't borrow our way out of this. Some people may wonder why we don't wait and see whether or not the federal government agrees to give us flexibility to pay for lost revenues out of the past coronavirus relief fund or any new bill that may come out of Washington, D.C. I understand these sentiments. I don't agree with those approaches. I'll respond to each of those. I don't think it's fiscally responsible to decimate our reserves or to borrow. While our reserves are strong, we have no idea how long the economy will take to recover. Emptying our reserves in the short term leaves us in a very risky position in the longer term. Borrowing just would kick the can down the road to future administrations. And either approach, decimating our reserves or borrowing, is likely to damage our credit rating, which would make future borrowing even more expensive. We received $215 million from the Federal CARES Act, but that money is very limited in how it can be used. It can only be used for COVID-related expenses. We're spending it to protect our citizens and stabilize our small businesses, but that money cannot be used to replace lost revenue. We've been actively lobbying our federal elected officials to enact legislation that would either give us more money or give us more flexibility with respect to the prior coronavirus relief fund, or both. But so far, we've not been successful. I want you to know we're going to keep trying. I've engaged with both of our U.S. senators and our congressional delegation. We're discussing a joint effort with Governor DeWine and the state. Our lobbyists are still working on these efforts too. If at some point we do gain the flexibility we're seeking, then of course, we'll revisit our plan for budget cuts. But in the meantime, we can't close our eyes and hope that things will change. We must immediately begin to reduce our budgeted expenses by imposing 2-week furloughs, instituting a hiring freeze, and asking departments to submit proposals for 15% cuts. These cuts are really hard, and I know that they're painful. But for every month we delay, if the federal government doesn't give us more, it'll just get harder and harder to fill our growing budget hole. Taking firm action now will enable us to continue to provide the essential services people need while putting us in a position to emerge from this crisis strong, resilient, and ready to move forward. Thank you.
Mr. Chairman.
Council President Brady.
No, I'm sorry, that was Councilman Gallagher.
Okay, I'm sorry. Councilman Gallagher.
Thank you, Mr. Chair. Mr. Budish, on the 15% cut, do you have a guarantee from all divisions to take 15?
We're at this point, we've asked all the divisions to propose 15% cuts, and we're still waiting, going through that.
You haven't agreed to less than that with anyone?
We've not agreed to anything yet. We've asked for 15% cuts.
Okay, I'm hearing different, but I hear a lot of things. Have we talked to the state about the rainy day fund?
About which rainy day fund, ours or theirs?
The state rainy day fund, it's raining.
I believe the governor announced today that he was not touching their rainy day fund.
Oh, he must be in a dry place. all people that I trust regarding the amount of time to recover from this is 13 quarters, which brings us 39 months, which is incredibly bad. And I'm not against the attempts that you're making to kind of whittle down our losses now so we don't pay forever for this thing. But I think everybody has to have a piece of this. And like I said, I'm hearing different things on the 15%. And let's face it, not everybody is made the same. You know, you can't cut 15% from the sheriff right now to jail. You can't do it. You know those numbers, and I know those numbers are going to climb again the minute we're out of this. We all know that's true, even though that number is 1,000, which makes our chairman happy, makes me happy, but we all know those numbers are going to go up. So I would be very cautious on what we do with various divisions within the county as far as necessity goes. But I would certainly push in a very strong way the governor to wake up and spend that rainy day fund. It's raining. Thank you.
I appreciate that, Councilman Gallagher. Thank you.
Chair.
Thank you.
Thank you so much. Through the chair to the executive, good afternoon. I want to share the sentiment of my colleague Gallagher and be more specific about these cuts, the 15% request across the board. I don't understand why this request did not include a more strategic approach to say that some departments, Health and Human Service, should not be treated the same as a different department. We need more workers there right now because of this virus and food shortage and TANF dollars, and help to the Health and Human Service community that needs the money, and the sheriff's department needs the money, the jail needs the money, and perhaps there's other departments that could go lighter right now. So it's easy to just say we want 15% across the board, but that makes no strategic sense when we're facing this pandemic. Not all departments should be treated equally. Why haven't your administration made a more strategic approach to cutting what you say is necessary at this time?
Well, we are making a strategic approach. We haven't cut 15% from anybody yet. All we're doing is asking for each department to present to us what a 15% cut will look like. Then we'll go through them and make our decisions. And I believe we will be very strategic. You mentioned, why aren't we spending money, or why aren't we looking at spending money on things related to the coronavirus? We've been doing that every day. That's what the $215 million is for. And I can give you a list of things that we've been spending it on. All of those relate to helping people get through this pandemic.
Mr. Chair, to the executive, I appreciate that we have the $215 million, but when we're asking for 15% across the board and furloughs, that doesn't equate to being strategic about where things should be cut and where they shouldn't. So that's all I'm asking, is that we really don't treat this cookie cutter right now. We do have these dollars coming in, but we also have to be strategic when we're asking employees to furlough at this time.
I understand what you're saying. I would just note that we have to come up with enough money to fill our budget hole. And if we don't take it from one department, I just note it means more coming out of another department.
Mr. Chair, one more thing is that we set aside this money, County Council did way at the beginning, to be there in case of a storm, some unprecedented event like this. So we didn't have our employees having to take hits when they budget dependent upon their payroll, and that's why this money is here. So I just want to say that I think that's how we have to look at this, is that it is for all of our employees, and I don't think it's wise right now to be cutting and furloughing employees across the board when we have this rainy day fund to address and protect our own employees instead of other rationales. And I think it's premature. I don't have a firm basis upon your projections, and I think really we have a rainy day fund to bridge this gap so we can get a more specific look at what's actually the hit's going to be. That's all.
Jack Schron.
Mr. Chair.
Councilman Tron.
Yes, thank you, Mr. Chairman and Mr. County Executive. Have we looked at when you get to dramatic economic conditions like this, often you look at, is it a time to revamp the way you actually do business? And have we looked at strategic ways in which perhaps we, not even looking at, I'm agreeing with both my colleagues that 15% cuts across the board are not the way you try to look at it, you look at it strategically, but is it also a time you might look at even the structural way in which the departments are put together? Is it a time when I know business is looking at, do you really revamp the entire way we do business? Do we spend more? We've been operating now for 6-8 weeks by remote working. Is that a way in which we can find that we might be able to reduce our costs and you actually really change the structural way in which we deliver services and the way in which we actually even find that some of these services are not going to be applicable? I know that this is a chance in which perhaps you go back and you look at it with a complete white sheet of paper. What should county look like? What should county government look like? And I know my colleague, Mr. Gallagher, has often even suggested a buyout. This is the time when, if you were to do something like that, that you would revamp and look at the entire way in which the structure looks differently. You look at it from a strategy standpoint, just like a business would, for a 5-year or 10-year way in which this government, way we look today, is not really any different than when we took office more than 10 years ago. If you look at it, it's just gotten bigger. The number of people are the same. We have actually less people in the county, and yet we have not really changed the way in which we do business. So I'm encouraging you to look at this not just as a short-term window, but is this a chance that you bring some of the best and brightest from the county together to give you some suggestions, perhaps even the way Governor, then Mayor Voinovich did when he looked at it when we came out of that economic crisis years and years ago when he took over as mayor. Bring in some of the best and brightest and look at that. I know that early on in your administration, I presented you with the entire work packet from then Mayor Voinovich. I think this would be a time to go back and look at a fresh approach.
I appreciate that. And I agree with a lot of what you're saying. We have been looking at ways that we do business. We've changed a lot of the way we do business on a temporary basis. The question is, should we become permanent in some of those things? So for example, we have more remote work going on now than probably ever. And it's interesting. I just pulled out a sheet that I was given from the Job and Family Service folks. You know, they do a lot of their work through call centers, and the work is still being done, except the calls are often being answered at home now. The report that I got indicated, I guess they can now gauge the numbers of calls being made from home, the amount of time on the calls, all the data that you would get from the calls, and they're being more efficient from home than from the office. So I think you're right. It's a good time for us to take a look at how we do business. I know that our Public Works is looking at the space needs. Both, do we need more for certain things? Right now, because of the space needs and spacing the 6 feet, changing the way our lobbies look, but also, do we need as much office space at this point because of the remote work, if we're able to do that permanently? So a number of the things you're talking about, I think, are very good ideas, and we're planning on we're looking at them now.
Cornell Jones.
Vice President Jones.
Armin Wu.
This is Nan Baker.
My colleagues, as far as the 15% cut, we know smaller departments like sustainability and officer reentry, cuts like that could, either, if not a layoff, a cut in salary. But the larger departments, will you allow them to at least say in their expertise that there are critical services that are needed, and if they determine that they present less than 15%, if in their expertise they determine there are critical services that just need to be maintained?
All we've done so far is asked each department to present what a 15% reduction would look like. We'll go through that and we'll make decisions where we're going to have to make our cuts. Unfortunately, it looks like there will have to be cuts. Some departments are proposing some contracts be cut. Some departments are proposing no employee layoffs. I don't know how many have actually proposed any layoffs. We've got the hiring freeze in place, so we won't be filling many spots. But the answer to your question is largely yes. We're looking at each department and what they're proposing.
I guess the heart of my question is, will you allow the department to present less than 15, or will you as the administration make the determination of what will be less than 15?
We're asking every department to give us 15% proposals. So we're not telling departments they can come in with a 5% proposal.
Okay.
Mr. Executive, I'd like to put an alternative out there and just get your reaction to it. And not that this can correct the problem, but it might be an additional tool, which is that particularly in the wake of the new national projections from yesterday. My question is whether you believe that we have enough contact tracers working in the county. I know that New York City alone is talking like they're hiring 17,000 people. That if we get the kind of increase in the coronavirus that some people are talking about, we could need a lot of people to do contact tracing, and we could train some of those 232 people or so that are currently not working, just sitting at home, and we could have some of the people who, instead of being on furlough, they could spend part of their time doing contact tracing, and we could train these folks, and both the training and the service would be eligible for CARE Act reimbursement because it would be COVID-19 related, and it might be a way to keep people on our payroll doing work that's urgently needed to protect our health and safety.
I'm entirely supportive of more testing and more contact tracing. I know those have been issues that you've focused on, and I might suggest, I believe that Terry Allen's in the chamber and willing to answer those questions, talk about the contact tracing if you'd like.
That would be helpful if Director Allen could make a comment on that.
Here he comes. Mr. Chairman and Councilman Miller, so the governor has proposed a plan to increase contact tracing capacity for the state at state and local health departments by essentially 1,000 people. That includes retasking some staff at the health department that are doing other things that can qualify for contact tracing, people like public health nurses, for instance, that have experience with this work. There are clinical aspects of this work also where people may have comorbidities, multiple chronic conditions, and how COVID may affect them that have to be discussed sometimes at the point of talking to cases when they're first identified. So there's really three pieces to this. It's a combination of retasking existing staff, also identifying volunteers, and we've actually had a cohort of volunteers working with us from the medical school since the beginning of March, and then now a plan to expand contact tracing based on establishing some surge indicators on the number of cases, and we've been tracking, of course, cases since the beginning, tracking hospitalizations, ICU bed utilization, ventilator utilization. Some of these triggers are being looked at to make determinations on when we surge, and so we certainly are looking ahead to the fall. We are anticipating the potential for a surge in September when flu season starts, potential co-infection
with COVID and influenza. So we're planning on identifying additional people to support our contact tracing capacity. We have about 50 folks to date that have been working on contact tracing in one form or another. Our department, the governor is recommending one contact tracer per, 10 to 15 contact tracers per 100,000 population. So we're talking about potentially surging for another 30 or 40 folks, epidemiologists, public health nurses. We have a number of environmental public health investigators that do outbreak investigation as well, and others. And so that's currently our plan moving forward, and we're building that plan right now.
Director, are we currently able to do contact tracing on all new cases that are coming forward at this time, or just some of them?
We're doing contact tracing on every case and also reaching out to that initial case and everyone that they come in contact with. So there are over 2,300 people that have been cases in the county, and for every case there are perhaps triple the number of contacts. And so we have, in our jurisdiction for the Board of Health, we have been running 7 days and doing contact tracing, identifying cases and all of the people that they've had close contact with since the beginning.
Okay, thank you.
Thank you.
And I've told Director Allen that we're there for whatever they need.
Okay, thank you. I would now call upon if Director Mason or rather Chief Mason or Director Chambers has additional information to provide us on the financial situation.
Sure. Give me 1 second to pull. I'm going to pull up a sheet for you real quick. No. Yeah, that one. Do we hit share? There we go.
Trevor needs to allow us to share.
Trevor, can you allow me to share?
Yep, give me 1 second.
1001? No, just kidding.
Come on, Trevor.
It's set for allow to share screen. It should let.
There we go. I think we're in Trevor.
That's it. This one? Yeah.
Yeah. Whoopsie. Okay. I know we kind of gave you a high-level review last week, and following up, from our initial projections. Once again, we started this a while back. This is kind of bringing everything together, maybe on one sheet of paper, to try and give everyone kind of an overview. I'll start up here at the top where our beginning cash balance is $120 million in our reserve. Okay, once again, as the executive stated, we got a $76 million projection. And as you just heard Director Allen say, things may change again in the fall. As I indicated to you last week on that spreadsheet that I had, I wasn't assuming too much. I had highlighted those areas as potential maybe decreases depending upon a whole lot of other information and, vaccinations and things like that. So that 76 million is still the total that we came up with. If you recall, it was 53 million in property taxes and approximately 23 million in our other revenues.
Sales taxes.
I'm sorry, not sales. Yeah, sales tax. I apologize. 53 million in sales tax and 23 million in property tax, interest, and our other revenues. So that gives us a total operating, once again, of 398. Then we bring in our expenditures. Once again, this is our 10-day furlough estimate. This includes everyone except for the HHS side of the operation, which is 11.5 million. Once again, we're still working through some with the courts, so some of that number does include that in there. To counter that, I also I left out the PERS and the Medicare contribution as kind of my buffer, so depending upon what happens with the court. So I'm going with the 11.5 million for the furlough. And then here's, the budget estimates so far. As the executive said, we're still going and gathering the information. We're asking everyone to come up with a 15% cut. We're asking them to do both anything that they can within their budgets to get to that point. No decisions have been made, but right now we feel optimistic that what we've received so far is about $18 million that we can anticipate. We're hoping to continue to raise that up. Once again, that does not equal the total 15%, if you take the entire budget we're talking about. But this is where we're at right now today. And there's nothing included in there for the courts at this time. We're still working through that as well. So just rough math here, as you can see, the 120 plus, minus, we're at 62 million. And once again, we definitely are dipping into our reserves. There's no doubt about that. Let me just move this down a little bit more. So once again, on the left here was our beginning budget, and on the right is the revised budget. So you're familiar with the economic development, the ERP, we have the demolition fund, and the Sherwin-Williams incentive. From there, we have to also now account for the hotel and the subsequent property tax payment. And working with CMH Warwick, this is the current estimate that we're going to have to assist the hotel with is $12 million. On top of that, our parking lot are empty right now, and we have a debt obligation of $1.5 million, and the revenues there, we're going to be depleting our entire surplus in that area right now. So that $1.5 million represents the debt service that the HPG parking garage is supposed to pay this year, and they will not have the funds right now. And these other two now, obviously the bed taxes and the admission fees, those are other revenues that we were anticipating on to help pay for debt service. And right now, based on everything we know, that obviously the hotels are empty and the admissions aren't happening. We added that in there as a safety net, bringing our total reserve on balance of $45 million. And you see it right here, $23.5 million. So we went from $120 million to $23.5 million. Once again, we're hoping to, obviously, if we can do any more with our budget cuts, and once again, on the revenues. That's assuming a 20% impact, which once again, everything that we're seeing is pretty reasonable at this time. So I'll stop there for a second if there's questions.
Mr. Chairman?
Yes.
Thank you, Mr. Chairman. Through the chair to Mr. Chambers. I got a question on that starting cash balance. Shouldn't that actually be a number? Shouldn't it be the same at the start of the year? Wouldn't that be the same number? That's actual money that's there.
Yeah, the difference with this actual money is excuse me, I don't mean to hit that there. Within that 142 is reserve monies from the Title Bureau that was combined with the general fund last year. So we backed those out because I wanted to show you the true unreserved cash is the 120. Unfortunately, if I had my Excel spreadsheet, I could have highlighted. I had a detail in there exactly what the differences was. But we backed out items that were added to the general fund under the, in the past, which are actually reserved funds. So to include them in there, Councilman, would not be appropriate.
Okay.
When I say reserved, I mean restricted to a certain purpose.
Okay, and so that's what I wanted to clarify. So when you're using the term reserve, you're not talking about those monies that we have set aside?
No.
General fund reserves.
Right. For the auto title, I think is $6+ million, and I'm slipping on the other couple reasons that's in there that makes up that difference.
I just wanted to clarify that. Okay, thank you.
Sure.
Mr. Chair?
Yes, Councilwoman Baker.
Thank you. Mr. Chambers, are we factoring how vulnerable we were at budget before this pandemic? Are we also including some of the indictments that are coming down the pike, and their court dates are coming up in October, potential lawsuits? We have continued ERP costs beyond what's listed, the jail costs that have been, that we are continuing to invest in. Have you integrated those future costs in with your potential future costs
because of this pandemic? Where are we on those issues that were pretty high level before this pandemic began?
Yeah, I've listed what I believe is known and realistic to have. I'm not saying that what you're saying is not on there, but I've listed everything that I'm aware of that's impacting us right now. So those would be additional draws on our reserves when that time comes.
So if I may follow up, so for example, the ERP, we already know we're going to be impacted by that, but we're definitely going to be impacted,
This budget's up to date,
especially
though.
because of the pause, more so.
Yeah, as of right now, that Councilman, as of right now, that 7.8 is the latest number. Once again, yes, we are not final, but we're hoping to be really close to that.
And the cost, the future continued jail costs, the potential lawsuits, things that we know are going to be happening. I mean, much of this is subjective. You know, we're trying to put our arms around what we think costs are going to be. Would it make sense to put some of these other pieces in there too, just so we have a true picture of where we may be 6 months from now?
Yeah, and please, I don't disagree with you, but also there's an impact to next year going in as well that we have to start considering as well. I wanted to share with you right now where we're at, and you're true. We have to start working on all those factors and start looking into next year as well, where the property tax impact might be a lot larger.
Right. All right. Thank you.
Sure.
Mr. Chair,
Yes, Ms. Brown.
thank you. I was just curious, do we have one of these for Health and Human Services?
We sure do. Would you like to see it? Here,
Yeah,
let me pull it
please.
up. Oh, my bad. Get out of there. Jonathan, get over and get rid of that silly thing. Where is it? This one?
Yeah, I think
That's it right under it? Nah, that bugger's on the way. There you go. Okay. I'm going to let Walter discuss this one, but you can take a quick look at it.
Okay, good afternoon, Walter Parfiowitz. Same basic format that Mike went over with the general fund. We start out with the beginning balance of about $3.5 million. Levy generates about $244 million. We're anticipating a 10% cut there as well, so about $24 million. Brings operating revenue to $219 million. Operating expenses basically budgeted at the same number, but now we've got a 10-day furlough and we're taking 15%. I just want to be clear, it's not 15% of the departmental budgets, that's 15% of the subsidy that each department receives. Brings operating expenses to $228 million with an ending cash balance of just under $5 million. The things that we have in the budget for Health and Human Services, the budget was passed with a Mental Health Diversion Center for $2.5 million. You'll see that down below in the reserve balance, as well as board and care expenses for Children and Family Services of another $1 million. Those will now be funded with opioid funding, and we will not be needing those. They will not show up as expenditures on the HHS levy side. In addition to that, we had a $34 million balance in our what we used to call our PA reserve, or what we still call our PA reserve. Now that balance should only include about 14 of that $34 million just to cover encumbrances from the prior year. So we believe that we have approximately $20 million in reserve balances in public assistance, children's services, and child support. If you remove those reserve balances and put those back into the levy, you see our number gets slightly better. We end the year about $18 million, or 9%, close to our 10% requirement. Questions?
Thank you. I was a little bit concerned, but you covered it as it related to the reduction in the projection. So thank you.
You're welcome.
So, Director, after the meeting, could you send the spreadsheets to the clerk so that she can distribute them to the council and we can further study
Certainly.
them on our own?
Certainly.
Thank you.
You're
Other
welcome.
questions?
I have one, Dan Baker.
Yes, Ms. Baker.
We were discussing in Board of Control how we would know what costs are associated with the CARES Act and what are not, and what might potentially be, could be in question. And we learned that there was a code, a fiscal code that was attached to the request for payment. Are we, are you engaged in that? Are you well involved in making sure that when we ask for different requests that we know exactly whether that is going to be part of the CARES or whether investigation needs to continue to decide whether it's going to be part of the CARES? How involved are you in that process, especially as we're talking about the HHS funding?
Councilwoman Baker, Mike and I are both involved in that process. We established the code, and we're looking for that code to be on every expense that relates to COVID-19, so that in our new system, if the code is there, we'll be able to run a quick report and aggregate those expenses very quickly and charge the government appropriately.
Communication for those that are asked for these services, they're well aware of making sure that that these need to be coded.
Oh, absolutely. Mike, you want to talk about what's your process?
I will, yeah. Let me just pull this up again. The process is, as we indicated, the vast majority of the COVID is coming through the emergency purchases that comes through the department to myself, to the executive, and over to Council President Brady. Those are going to be the majority of the dollars we're talking about. There's going to be a lot of smaller dollar office supply, hand cleaners. Obviously, there were some items with the sheriff, and as they indicated, they certainly have coded all of those with the correct accounting code, which we will pick up and eventually do journal entries from their budget over to, obviously, the COVID funds. If I had to put a guesstimate on everything, right now, we're probably talking $100,000, but maybe by the end of this will be a lot more. The intent is to try, and the big ticket items is to run through that emergency purchase process. But yes, we're ready to run them all and go through their budgets, and it's going to help them a little bit, but it's not going to make a big dent, as far as the overall reserves. But we are certainly tracking. I have Matt Ruby assigned to that, and we're going to assign an accountant underneath him to also maintain this information.
And just following that same vein of thought, the opioid dealers that we are using for those specific services, that also code so that we know exactly where the dollars are flowing?
Yeah, the opioid, any funding will be used and coded against, just like the COVID has a specific accounting unit, the opioid funds has one as well. So as it's being drawn down, it'll be expensed right to that accounting unit. Yeah, everything stays in that fund.
Good. Thank you very much. I
Sure.
appreciate it.
I would like to point out one thing too, because part of the last presentation last week, I sent something very similar to this, which was kind of our initial projections. But over the last couple of weeks, this is these additional items here have become more and more known and more visible. So just to in case there's a question as what changed from the last time I sent this to you, obviously we got more information. Yeah.
If I may follow up, I'm sorry, I just thought of something I'd like to follow up with. Thank you, Mr. Chair. Mr. Chambers, how are you going to separate, say there's a lot of money flowing through it now, especially as trying to provide these services, when there's a blend of services, some do qualify, some don't, but where they're within the same ask. Do you have a procedure that you're able to separate if that does happen, that we're providing a service that maybe 25% of it does not apply, but the other 75% does, and so we code differently? How are you managing that?
Yeah, if it's related to COVID, we're going to try to utilize that fund. I mean, we have to be very careful. There's strict guidelines that we don't supplant, and or else we have to pay it all back. So we've instructed everyone to utilize the accounting unit, activity code. Obviously, for these bigger purchases, those are 100% COVID. Those are our big dollar ones. But when you get to some of these smaller ones, as long as they use that activity code, we can look at it. Part of the job of the grant manager and the accountant that we're assigning to them is to go through those, run the report, make sure they are valid. And when in doubt, we're not going to include it. We want to make sure that we can audit it, it's auditable, and we have all the support for it. Because once again, we will have to pay it back if we're wrong.
Right. Okay. Thank you very much.
Sure.
Other questions?
Yes,
Oh, go on.
Councilman.
Council President, go ahead. I'll defer.
Council President.
Okay, well, I mean, I wanted to make some, some general comments. First of all, I appreciate the fact that the executive set a precedent today by initiating a dialogue between himself and the council in a way that we've never seen actually in a committee of the whole before. And I think that worked well, and I think that the council would like to initiate more discussions like that in the future with the executive. I thought it was quite helpful. I don't think that a lot of several members of council, including myself, are confident that these projections, knowing that you have to be guessing to some extent, are projections that we can count on. We really, have some concerns about the 15% across the board cuts. There's sort of a semantical discussion here in some ways, where in some cases we talk about this 15% across the board cut as if it's, as if that's the way we're going to go. And then we sort of backtrack and we say, well, we're just asking for it. And then we'll take a look at it and decide what's appropriate and what isn't. So that's encouraging, because all we were ever looking for was a very targeted approach to any cuts that might be proposed. And it did not sound for some time like these, any cuts were actually being targeted. It seemed across the board, a broad brush approach in a way that we know doesn't make sense. It may be easier on the math, but it doesn't make any sense at all from my point of view. I'd also like to say that I think this has been a good dialogue that we've got going with the administration around a wide range of issues. So in that spirit, I certainly want to continue for that to be the case. I do think that there's a very good chance now, as we get more information, which is widely available. There's no secret syrup here, sauce. That the federal government is very likely going to pass more legislation, more stimulus legislation, perhaps looking more likely than it did the last time we spoke. That those funds that will be they'll be more creative and more flexible and allow us to use some of those funds and other local governments and states for revenue loss. And we haven't seen any real information come in precisely about, for instance, the sales tax, which is due in a couple of weeks. Some hard numbers on the latest sales tax. Is that correct?
Yeah, it should be coming in soon. Yes, probably, I'm guessing by the end of this week.
So I think that we've got a lot of information coming in soon in terms of what's going on in Washington, what's going on with our sales tax. And we're just, I, for one, am just, concerned about, all the weight falling on many of our employees who this government certainly, needs. And certainly we want to make sure that people in frontline positions are not jeopardized. And I think that, there's a matter of uncertainty that goes on with our employees when we talk broadly about furloughs and 15% across the board cuts and, potential layoffs. This is a disturbing factor for people who work for the county. And I know we're trying to plow through that, and I'm not, we're looking for a place that we can agree and we can land. And, this is an unprecedented situation. We know that there may be things that we need to do down the road that we would prefer not to do. But government services are a critical part of keeping, this economy and our social contract with the people of Cuyahoga County intact. And need I remind everybody, which I'm sure I don't need to, that 70% of the voters recently raised their own taxes. So I think they sent a very strong message to us and a very strong mandate about their support for our health and human services, and particularly in these times. And so I would hope that we would have heard that in terms of them saying what their priorities are, as well as what we as individuals may see as our own priorities. So thank you.
Councilman Tuma is next.
Thank you, Mr. Chairman, and thank you, Mr. President. My question is, I guess it's going along these same lines of continued dialogue. I'm just hitchhiking a little bit off of what was spoken about earlier with Councilwoman Simon and these reserves that are out there. I understand if you tap the entire reserve, you're going to have issues with your bond rating and such. But I think it would be wise to at least examine looking at taking some of those reserves and using some of those reserves, because as Councilman Gallagher said, I mean, if this isn't a rainy day, I really don't know what else would qualify. And I'd really like to hear back from the county executive as to what he feels constitutes a rainy day, because this would be it. This would be my idea of, boy, we need help. Council set up those rules for a reason. I'm not saying tap the entire thing, but by certainly if you can examine looking at taking some of those reserves to help out a situation in the short term, then it would be prudent to at least look at that. So I'd like to hear back from someone from the administration, preferably the executive, on that, on his ideas on that.
I think if we can pull my spreadsheet back up, Councilman, you will see that we are definitely tapping the reserves, probably $100 million of them.
Well, then maybe I'm misunderstanding something, because earlier I thought the executive said that you guys weren't touching the general reserve that council set aside.
No, if you look real quick, we started with 120. This is our reserves right there. Once again, assuming that loss. It could go up or down from there. And as Director Allen said, I didn't plan for the fall. So this is based on our estimates, and I think we were showing maybe 85% revenue in the fall. But we're going to end, our projected ending balance is 23 million. So, we're looking at about $100 million hit right now. These are known. I know these are all known from our consultants. We know this from our parking lot. Bed taxes, if anything, it might go down a little bit, but these are all known facts. We know the furlough, so yeah, we're definitely tapping them.
Okay, I guess I'm gonna, how much are you anticipating tapping then?
Well, the 120 from the top down to the 23, so 97 million. Now, once again, there's a lot that can happen between now and the end. Can you see the share that I'm? Maybe you can't see that spreadsheet.
I don't see any.
Oh, I apologize. My bad. Jonathan. That one, yeah. Sorry. My apology. I thought you could see it.
Some stuff is up now.
Yeah, so here you are. Here's the top is the 120 million right there. And once again, as I indicated, the 76 million didn't include anything from the fall. It assumed, revenues would start going back normal. And then, so when you get down to the bottom here, the ending balance we're looking at, considering everything's 23 million. So that's basically a $97 million hit. These are all known, like I was indicating. This is definitely our stuff from the hotel. It's property taxes. And you can see the bed taxes that we have debt out there for that we'll have to back because the hotels are empty. and the admissions. And this is the thing that was different from the last chart that I sent you guys a week ago, or our last presentation. I kind of gave you one of these. We never had time to get to it, but I updated this with more information.
So Councilman Tuma, to give you a quick summary, the director's projecting that we might need to use about 80% of the county's general fund reserve before the end of this year. So that is really a heavy hit.
Okay, so 80% is the number. See, maybe I misunderstood the executive in his initial dialogue or conversation. I thought he said that he didn't want to go into the reserves, but maybe I misunderstood that.
Yeah, I mean, everything we do from here on out is to try and, impact that. And I believe you hit it on the head beginning. I mean, we're looking at, we just finished refunding a bond deal last week. And we did meet our projected target, but we have a lot more bonds where the market is very attractive. But unfortunately, that cash balance was very helpful to us. So that will, there's not even impact on that weight into this yet.
Okay. All right, I'll have to look at some of this too.
Sure,
as
yeah.
Councilman Strawn was discussing prior to the meeting, it's a little bit difficult trying to figure out these numbers when they're presented to us, and then they're ever changing, and we're trying to have a dialogue, but it's difficult under these circumstances to figure out. So I'll look at those again.
Sure.
Appreciate it, though.
Sure.
Other questions or comments?
I have one question, Van Baker.
Ms. Baker, please proceed.
Thank you. To Mr. Chambers, I know in the last budget, we accounted for the vacancies. I believe Maggie Keenan tried to eliminate many of the vacancies that we thought we were not going to be filling, and eliminated them. Are you in a good position of the vacancies that exist perhaps in our budget that we may or may not be filling? Is that a place where we could
like
be
11 million,
inflated in our costs?
Yeah, if I'm shooting from memory, I believe our vacancy was about 11 million. We presented that, and I know that obviously some of those are critical positions we have to fill, but a lot of the departments, in order to meet their cuts, use their vacancies. In addition to additional contracts and services that they were able to do without, or decrease, I should say.
If I may follow up,
Sure.
Please.
are the $11 million in vacancies, are those reasonable vacancies? Are those
were, yeah.
high-level vacancies that we need to fulfill, especially in the IT area with the ERP? But are you comfortable with that amount of vacancy and the dollar amount attached to it?
Yeah, once again, the critical ones, including those IT, I have a controller spot that's vacant. Those will get filled. I didn't want to allude that the entire 11 million was not going to be, allowed. That's not the case. But the departments made some, decisions themselves to not fill those vacancies, to make things work and help make their budget cut with that. But certainly we're going to have to spend money on those vacancies and fill those critical spots.
Right. Thank you.
Sure.
Mr. Chair.
Ms. Brown.
Thank you. I'm looking at your shared screen, Mr. Chambers, and I see you have a debt tab at the upper right, and we haven't talked about that. Is that something you can share with us?
Sure. Very observant. Let me pull it up here. Let's see. Yeah. How do we get rid of plus? I was trying to get rid of that. A lot of information there. Can we do that? All right. Somewhere in the middle there. What do you think? Do you want to take a swing at it? Yeah.
Yeah, I'll give this one a shot. What we tried to do here was detail out all of our outstanding debt. So down the left-hand side, you see general obligation bonds, followed by, say, sales tax revenue bonds, followed by non-tax revenue bonds, and also the hotel, the certificates of participation on the Hilton Hotel. So we have right now $1.4 billion of outstanding debt. And on an annual basis this year, we're required to pay $119 million. $74 million of that comes from the general fund, and the other $45 million comes from external sources. And you'll see external basically described there off to the right. I know it's a fairly large spreadsheet, but we get into bed taxes, admission taxes, sin taxes, Hilton Hotel revenue, and then the Huntington parking garage revenue, the TIF, some interest subsidy, some capitalized interest, special assessments, Cavs pay us rent, and then we also have loan payments that will be made from various development companies. We just thought that we would have this available if anyone wanted to ask any questions about all of our outstanding debt.
So out of the 119 million we've already paid, this gives us a general sense of what we still owe. Is that?
This was really meant just to give you an overview, because some of the numbers on the other spreadsheet related to debt that we're going to have to offset with our general fund reserves, because like I mentioned, the bed tax, the sin tax, and the admissions tax and things like that. The reason being is because those were dedicated funding sources to repay some of that debt. Obviously, once again, with the hotels and the admissions and stuff like that, that's now going to fall back onto the county. And these were some of the bonds.
So what more do we owe out of the 119? Like, how much do we still?
This isn't what we got right here. I'd have to get that for you. This was meant just to really get into the question why we have the admission tax and the sin tax and why we were putting, those numbers on that other sheet. It's not an all-encompassing document. We can get that for you. I was hoping not to get into the whole debt structure, but it was just to try and tell you that we have needs and we have obligations and sources that if, because of the economy, the county now will have to pay that.
Okay, but you will get that to us?
Yeah.
Okay, all right, thank you.
Mr. Chairman, Mr. Chairman, Jack Schrock.
Councilman Tron.
On that same point, with the debt structure, as you were looking at that, is this an opportunity with the interest rates being at their all-time low on the borrowing side that we could stack any of this and save some of that annual payments that Ms. Brown was asking about with lower interest rates?
Absolutely, Councilman. We are getting ready to bring something before you pretty soon to look at the authority to refund the medical mart. I believe that's the $224 million change there. So yeah, everything here is on the table. I know Bob France is on the phone, but we are looking at all of our opportunities here in this low interest rate market. Flip side of that,
we're never going to get a better lower interest rate. So assuming the structure can handle the refinancing, it seems to be a good time to be looking at it.
Yeah, we just got through finishing last week these three here, the Gateway, Brownfield, Commercial, 2010s. So that just was wrapped up last week. We're getting ready to bring before you this one, this big one. And, if I go back to this sheet, though, wrong one again, my bad, the general fund here, this low cash balance is, the 120 was very helpful to us. So I'm hoping because of this and what's going on in the economy, that could help, that could hurt us a little bit. So, but it's good that we have the reserves that, having the 120 right now still stands, but we obviously have commitments against it. We'd have to disclose that.
Mr. Chairman, this is Cheryl. Could I ask a question, please?
Yes, you may.
When you send us the additional information, Director Chambers, could you also talk about the restructuring and how much cash we save with the restructuring?
Sure, yeah. This last one, I believe we saved, I want to say it's 3.5 million, but I'll get that for sure. That's present value, yeah. So, and we're hoping we can do good with this next one, obviously.
So, Director, other than what you mentioned and put on the reserve sheet about the admissions tax, the bed tax, and the sin tax, are there any other problems that you anticipate that we have regarding meeting our debt obligations?
Councilman, it's a living document, and I mean, so far, like I said, from within a couple of weeks' time, originally the hotel was gonna, minimal opportunity. They were projecting to come back into service. Our hotel is still open. But the bottom line is this all was kind of very fluid, these add-ons. So as I mentioned before, if you look at the document I sent you last week, you'll see that these weren't on there. But they were included in the answers to one of the questions about, you'll see it was $20 million.
Are there other questions from my colleagues?
Mr. Chairman.
Vice President
Chairman
Chambers.
Brown. Thank you. Mr. Chambers, can you tell me of the $215 million, if any, we've had it about a week now. Can you tell me how much of that money has been spent?
Right now, we've encumbered through council. We've got appropriated, I should say, $6 million. I believe we've just hit $3 million. We've had a little bit more, but some of our orders got canceled. And I know that right now the departments are going to be coming back real soon with some big asks. I know Public Works is working on a presentation and things like that, as well as, some long-term changes, as we indicated, to maintain safe distances. So, but right now it's about $3 million.
And briefly, can you just describe what that $3 million has gone towards?
Shooting from memory, I think $500,000-600,000 has gone just for medical screening at our buildings, taking temperatures, doing the questions. I want to say $1 million or so has been for PPE, personal protective, equipment, gloves, masks, shields, suits. And then there was some IT computers, that we purchased for, work at home. That's pretty much the main points.
Okay. Mr. Chairman, Terry Allen, who was there briefly, it'd be great to be able to ask him a few questions if time permits.
Please proceed.
Great.
I'll get them up here for you.
Okay.
Should we get rid of that? Yeah, go ahead. Yeah, there it is. There you go. All right.
Mr. Allen?
Councilman, how are you?
Great. I'm doing fine. One, I want to thank you for the emails you sent me, giving me an update on, giving us the update on the efforts that have been made, especially around the healthcare industry and the nursing home industry, those frontline workers there. Reviewing some of your paperwork, I see that there are at least 30 nursing homes that have COVID in either the patients or the staff. Can you describe a little bit of how the testing has gone to keep these facilities as clear as possible?
Thank you, Councilman Jones, for your question. So since the probably early March, we certainly know that risks, even with seasonal influenza, are greater in these congregate settings like nursing homes and skilled nursing facilities, correctional facilities, homeless shelters, recovery houses, developmental disability, adult care homes, a range of settings where people are close together all pose a risk for COVID transmission. And so that's been known from the beginning, and given the fact that the data is showing perhaps 25 to 50% of people, based on some National Institutes of Health data, are indicating that they may be asymptomatic. That is, they may be capable of spreading without showing any symptoms, creates a challenge in many environments, which is why the public discussion around masks has been so critical. If I wear a mask, I protect you from me, and if you wear a mask, we protect each other. So those pieces have been critical in the public setting as well around asymptomatic transmission. So these settings are inherently at risk. And then if we add the other layer of folks in nursing homes who often have chronic conditions and and many other complications that put them further at risk. So from a testing standpoint, we have 6 preventive medicine physicians that have been working with us from the beginning of the response, our medical director and a range of colleagues that we've been working with, and they've been doing some targeted testing in different long-term care facilities to identify potential clusters based on symptomatic folks, and then beginning to make determinations on how we look at both residents and staff, and at the time based on when testing was available to us. As we know nationally, the rollout of testing has been slow and has not been anywhere near optimal in terms of what our needs are. So now we're beginning to see more testing become available here. The governor has said potentially up to 1 million tests by the end of the month, and that will mean that there'll be more testing widely available to test in a range of those settings, also to look at some potential other community-based settings. And hospitals, of course, are doing testing within their facilities for the outpatients that are now coming back into their facilities for care. So we anticipate some of the testing to expand. The governor has identified several zones around the state. And in those zones, they've identified hospital leads associated with those zones here locally in the 30-county region that extends from Toledo to Youngstown. University hospitals and the Cleveland Clinic have been identified as leads for that zone. And within that zone, the hospitals then are charged to begin to provide a connection to each one of those long-term care facilities to provide supports. We've been working here in our county, of course, with Metro, Cleveland Clinic, and University hospitals. And Metro has been helping us from the very beginning. They've been an incredible partner. Dr. Boutros has been there providing us tests whatever he had available, even when they were they weren't widely available. So we expect that the testing will be more broad, and the state just this morning changed the testing criteria to make it more broad to where you can test people who may not be symptomatic in nursing homes that may be on a floor or a wing where there's an outbreak. So this is the testing criteria has changed based on the availability of testing.
When, as you mentioned, the asymptomatic individuals, those who come into the hospital or into a nursing home, what is that? I'm sorry, I was muted.
Okay.
So I heard everything you said. My question was, follow-up question was regarding the asymptomatic individuals as they come into the hospital and the nursing homes. Many times the test is just a swipe of the forehead. That's for the symptomatic individuals. But what is the timetable for the governor in terms of providing what is necessary to do an asymptomatic test for individuals and employees in particular going into those facilities?
I think, Councilman Jones, we're going to begin to see a ramp up of testing. As I mentioned, we're going to start seeing testing more widely available. We're already seeing a lot of private companies begin to offer testing capacity, but we're going to have to proceed in a way that we can manage from the public health standpoint. What we want to do is to identify and quickly suppress outbreaks within these congregate facilities, and then connect with the hospital partner that can do more widespread testing within all these facilities for both residents and staff. We work to make sure that the staff aren't moving between facilities so they don't spread it around, that they are isolating folks who are sick and then creating a wing of people who may be symptomatic in order to reduce spread. Our physicians are providing clinical hygiene guidance. Our environmental public health staff are providing facility hygiene and safety guidance, and our communications folks are assisting them. So I would expect in the coming weeks that the testing will ramp up. There are several testing modalities, as you know. There's a nasal pharyngeal swab, which is in the nose and goes very deep into the back of the throat, and that test is available. There's new testing coming online for saliva testing, which appears to be reliable. And then, of course, there is antibody testing that some of us have heard about, but right now it is not determined to be. CDC is making determinations on the reliability of those tests because there are 4 other coronaviruses that circulate seasonally that cause common symptoms that are similar to the common cold, and it could be reactive, cross-reactive with those other coronaviruses. So the serology is not optimal at this time. And we also don't know if you do have evidence of exposure in the past, whether that will impart any immunity or any immunity that will last for any appreciable period of time. So we're learning a lot in real time, and I expect the testing will get better very soon.
Very soon, can you give us a window, days, weeks, months, years, when the antibody testing will be more reliable?
I think that the diagnosis testing on whether you have active infection, here in the next couple weeks, I expect more testing to be made available. The antibody test, I think it may be within a month or so. I know that the hospital systems are doing their own validations, even here locally, on different tests that are available to see if they're reliable.
Okay. Yeah, my concern, again, is at the nursing home level, being a hotspot, if they can test those individuals and make sure that the employees are, because their work is so close to the patient, whether it's a transfer from a shower to a chair, from a wheelchair to a bed, that type of close contact, and they need to know who is and who is not, because they come back into the community. So really, what works in the nursing home is a model for other industries, all small business. What does it look like when you test everyone in these essential businesses? If we know who they are, how we separate the patients, the residents, as well as separating the employees, keeping them away from the work when they are potentially asymptomatic. The moment we get to that point, that's going to be critical. And if it's a dollar amount, do we use some of our dollars? If it's something more logistical around why we don't have it, those are the answers also we want to have, and we'll have a greater comfort level once we can have that type of information.
Thank you, Councilman.
Okay. Thank you.
Mr. Chairman?
Council President.
Yes, Mr. Allen, good to see you.
Good to see you, Council President.
So to speak. It seems like forever since we were here in March in that room with you folks. I didn't expect you to be here today. Very glad you are. I'd like to invite you back, because there's a lot to discuss. Councilman Jones has brought up a lot of issues that are on a lot of our minds, and I really think that we would really love to have you and your people back for a fuller discussion about what you're doing, so we understand better how we fit into all of this.
Happy to come back, Council President.
Thank you.
Anything else from my colleagues?
Mr. Chairman?
Yes.
A question for Mr. Chambers.
Okay, please proceed.
Mr. Chambers, if I told you that tomorrow I could save $17 million, would you be interested?
Yes, Councilman, sure.
If I told you tomorrow I could save 11.3 million, would you be interested?
Yes.
If I told you tomorrow you could save 28.3 tomorrow?
You're setting me up. You're setting me up. Go ahead. Yep.
So why don't you take those numbers, and you can get it from Trevor, take them to the executive, because I have a fiduciary duty to the taxpayers of Cuyahoga County to uncover every dollar we can save, and those are your buyout numbers. That's 40, 60, and 0 replacements. You can look around. You don't have to look too far. 60% replacement, 11.3 in 1 year. 34 million over 3 years. I think that's a lot of money. It's a lot of umbrellas in a rainy period. So just saying. Thank you.
Anything else? Okay, I'm going to turn the meeting back to the Council President.
Thank you, Chairman Miller, and thank you, Mr. Chambers.
Okay.
I think we've had a really good discussion today, and the thing about the scale of this issue is the more we discuss, the more we need to discuss. And it's obviously a moving target, and numbers kind of bounce around, but I get that. So we're trying to be, flexible and we want to work, with the administration in this process, but we've got to be able to let you folks know what our thoughts are, ask our questions, do our due diligence as the, excuse me? Do our due diligence as the council to provide oversight even in this very difficult time. Is there any other miscellaneous business? I just wanted to say that for the council that starting next Tuesday, which will be our regular council meeting, if you're having a hard time telling the difference, we will begin to send legislation out to the committees as we did in the past, and those committee meetings will be held through this technology. And I want to encourage the councilmen who are looking at broader issues, and many people have brought up very interesting ideas, and I'd like to see those further discussed. And so starting next Tuesday, a week from today, we will be sending resolutions out to the council for regular business, but also I want to encourage council members who want to hold hearings in regard to these issues or other issues that are pressing before the council to begin to schedule those with the council. This is cumbersome. It is more difficult than us being together and having our ability to have conversations before and after meetings and those things that make things go a little more smoothly and are helpful. So beyond that, is there any other comments or yes, Mr. Chambers?
We do have one more comment, if you give me one second. I'm going to have Holly come up. As you know, we talked about her leaving, and I think she wants to address Mr. Gallagher's comment.
Okay.
Holly Woods, Interim Chief Director of HR. So I did want to follow through with the conversation on the buyout. Next Wednesday is my last day with the county, so it's probably the best opportunity to have some of that dialogue if you wish to have it today, because I've done some of the research and can respond to that. So just wanted to come up and offer that opportunity if you want to dive into the idea of the buyout any further.
I absolutely would, but I don't think now is the time. But here's what I would like for you to do. If you could meet with Trevor, who has done all of our numbers, and if I can somehow get on a conference call or come down there to meet with you, I'd be more than happy to do that before you leave.
Okay, will do.
As the chair of the HR, I'd like to also be privy to that meeting, Mr. Gallagher and Ms. Woods. So.
Okay, that was it, Council President. Thank you.
Okay, thank you, Mr. Chambers. Are there any other comments by councilmen, any miscellaneous business that members would like to bring before the council before we adjourn?
Mr. President?
Mr. Miller, and then was that Councilwoman Conwell?
Yes, I've been waiting patiently.
Mr. President, to my colleagues, just a committee announcement. The Finance and Budgeting Committee will meet at our regularly scheduled time the Monday after the council meeting. That would be on Monday the 18th at 1 o'clock via Zoom to discuss the first quarter report. We're going to have actual numbers for county performance for the first quarter, and also to have an update on the Harris project. That's the real property system that has also encountered difficulties. And I'm also working on having 1 or 2 meetings like we've had in the past regarding the ERP system for the next update to see where we are going into the the planned July cutover on payroll and we're planning that for the first week of June. Thank you very much, Mr. President.
Fine. Councilwoman Conwell.
Thank you, Mr. President. This question was for Armin. I waited patiently and then I didn't see him anymore and I thought he had left. So you stated earlier, Armin, when you get back the 15% cuts back from each department, there will have to be some decisions made. My question would be, what is the timeline that you think that you would get those decisions to council, especially chairs that are very concerned about their departments being cut? He's talking, but he's muted.
Story of my life.
Can somebody tell him he's muted? I did. Okay.
Should I try and answer it or what? Yeah. I just know, and he might be having problems there, but we are still working on gathering that data. And once we have it all together, we are going to sit down with the chief and with Armin to go through all of these things. And then, I'm hoping within the next week or so. Obviously, it's critical, but we want to make sure we do it right. So I don't want to rush and have something and come back. So there's a lot of information we're going through, and we are challenging the departments to come up with that 15%. And we are working, very hard with them. Our OBM analysts are working with each one of them and going through just to make sure that what they're proposing is doable, and go from there. So once we have all of that information, I'm sure at that time it'll be forthcoming.
Okay.
So unmute, by the way.
Oh, okay. There you go.
With Director Chambers.
Yes, I think the Director Chambers answered it. But what I wanted to know specifically, I know you have to do your due diligence amongst the administration side. I just want to know, once that decision is made, how long is it going to take the administration to let our staff know?
Yeah, I got help coming in to show me how to unmute. The answer is, as soon as we get the make the decision, we'll come to let you know what it is. There won't have to be a space in between those.
Okay, thank you. Thank you, Mr. President.
All right. Thank you, Councilwoman. Are there any other members who have any comments at this time? All right. Hearing none, this council meeting is adjourned, and thank everybody for their attendance and their